Okay, we're group 1 and we're here to discuss about the aneuploidy disorder, and our aneuploidy disorder is mainly about trisomy and trisomy 13, which means Patau Syndrome. Let's go now to the introduction. So what is trisomy? Trisomy is a type of polysomy in which there are 3 instances of a particular chromosome instead of the normal 2, characterized as autosomal trisomies. The number of chromosomes in the cell where trisomy occurs is represented as, for example, 2n plus 1 if one chromosome shows trisomy, 2n plus 1 plus 1 if 2 show trisomy.
Go.
Full trisomy, also called primary trisomy, means that an entire extra chromosome has been copied. Partial trisomy means that there is an extra copy of part of a chromosome, while secondary trisomy, the extra chromosome has quadruplicated arms. The arms are identical, it is an isochromosome. And thus is tertiary trisomy. The extra chromosome is made up of copies of arms from 2 other chromosomes. And let's go to the next. Most common types of autosomal trisomy that survive to birth in humans. So we have trisomy 21 Down syndrome, trisomy 18 Edwards syndrome, and trisomy 13 Patau syndrome, which is our topic to be discussed, trisomy 9, trisomy 8, which means Warkani syndrome 2, and trisomy 22. To the next one, let's go now to discovery. Who discovered the trisomy 13? So for the discovery, Dr. Patau named the syndrome to himself, which means Patau Syndrome. So he was born on 1908 and died on 1975. So for the history, trisomy 13 was first observed by Thomas Bartholin in 1657. Actually, Dr. Patau just expanded his observations. But the chromosomal nature of the disease was ascertained by Dr. Patau in 1960. The disease is named in his honor. That's what I said a while ago. And in England and Wales during 2008 and 2009, there were 172 diagnoses of Patau syndrome, trisomy 13, with 91% of diagnoses made prenatally. There were 111 elective abortions, 14 stillbirth miscarriage fetal deaths, 30 outcomes unknown, and 17 live births. Approximately 4% of Patau syndrome with unknown outcomes are likely to result in a live birth. Therefore, the total number of live births is estimated to be 18.
Now we move on to the causes of Patau syndrome. Patau syndrome is the result of trisomy 13, meaning each cell in the body has 3 copies of chromosome 13 instead of the usual 2. A small percentage of cases occur when only some of the body cells have an extra copy. Such cases are called mosaic Patau. First, mosaicism is a condition where the presence of an extra chromosome 13 is present only in some of the person's cells. Second, the majority of people with Patau syndrome have 3 copies of chromosome 13 in each cell of their body. Instead of the usual 2 copies, the excess genetic material is disruptive to their course of development. Third, an error in cell division called non-disjunction results in a reproductive cell with an abnormal number of chromosomes. And last, part of chromosome 13 becomes attached, translocated to another chromosome during the formation of reproductive cells, like in sperm or very early in fetal development.
Go.
So now we will be discussing about the signs and symptoms of the Patau disease. People affected by Patau syndrome many times have artifacts, small or poorly developed eyes, spinal cord or brain abnormalities, cleft lip or palate, extra toes or fingers, and decreased muscle tone. Numbers of babies with Patau syndrome do not grow or gain weight at the rate they are expected to, experience difficulties with feeding, as well as episodes where there have been a temporary cessation of spontaneous breathing or apnea. Additional features of Patau syndrome can include hernias, seizures, small eyes, small head, low-set ears, scalp defects, clenched hands, small lower jaw, mental retardation, single palmar crease, undescended testicle, skeletal abnormalities, hole, split, or cleft in the iris. Closed eyes, or eyes may actually fuse together.
So the definition of Patau syndrome. Patau syndrome is a syndrome caused by a chromosomal abnormality in which some or all of the cells of the body contain extra genetic material from chromosome 13. This can occur either because each cell contains a full extra copy of chromosome 13 or a disorder known as trisomy 13 or trisomy D, or because of each cell contains an extra partial copy of the chromosome, or because of the mosaic of Patau syndrome. So, in this figure, we can see that the chromosome 13 has 3 chromosomes. It is usually due to a free-standing trisomy with an extra or number 13 chromosome instead of the usual pair in all cells. An unbalanced chromosome translocation can also occur commonly. A Robertsonian translocation, in which an extra pair of copy of chromosome 13 is attached to another chromosome. There may also be a mosaic variation in which some of the cells are normal with 46 chromosomes and others have the extra chromosome. Infants with mosaic variations tend to be less severely affected. So babies with Patau syndrome grow slowly in the womb and have a low birth weight, along with a number of other serious medical problems. Patau syndrome affects about 1 in every 5,000 births. The risk of having a baby with Patau syndrome increases with the mother's age. More than 9 out of 10 children, over 90%, born with Patau syndrome die during the first year. About 5 to 10% of babies with less severe forms of the syndrome, such as partial or mosaic trisomy 13, live for more than a year.
Lastly is the treatment of Patau syndrome or trisomy 13. There's no specific treatment for Patau syndrome. As a result of the severe health problems a newborn baby with the syndrome will have, doctors usually focus on minimizing discomfort and ensuring the baby is able to feed. For the small numbers of babies with Patau syndrome who survive beyond the first few days of life, their care will depend on their specific symptoms and needs. If your baby is diagnosed with Patau syndrome, either before birth or shortly afterwards, you'll be offered counseling and support. Genetic testing for parents. Both parents will need to have their chromosomes analyzed if their baby is affected by Patau syndrome caused by a chromosomal translocation. Genetic testing is carried out to help parents plan for their future pregnancies rather than as part of the decision-making process for the current pregnancy. The test results will allow a more accurate assessment to be made of the likelihood of the syndrome affecting future pregnancies, and other family members may also be affected and should be tested.
Tapusin mo. End the report. End.
And
End.
ikaw na mag-end. Ikaw conclusion. Ikaw bala.
Wait lang, isipatin ko muna.
No, basta kahit ano.
So that's our report, gano'n.
Oo, basta kahit anong pang-ending.
Thank you for
We are group.
We are team banana.
O sige. Ay, gusto mo, konting tips.
Sorry.
Basta ikaw bahala kung anong gusto mo. Basta i-end mo na.
Now, this is...
Wait now. What? Ready ka na? Nakagana ka parang reporter. Patapos na reporter. Ibabalik mo na yung ballpen.
Ilang ilang.
Gagi ka, nagbibideo pa rin to. Gago.
Cut mo. So, the treatment of children with Patau syndrome involves planning on a case-by-case basis, meaning they will plan at different times. The forms of treatment a particular person receives is dependent upon the person's particular condition. As said before, intervention through surgical means are commonly withheld for the first few months of the person's life due to the high mortality rate of children with Patau syndrome. So mostly, they will always give surgery to babies with Patau syndrome. Patau syndrome involves many abnormalities that are not compatible with life. Greater than 80% of infants with the syndrome do not live past their first month. So complications due to the syndrome start nearly immediately, with many infants experiencing heart disease. So, and now that we have discussed the aneuploidy disease called trisomy 13 or the Patau syndrome and its definition, causes, signs and symptoms, and treatments, we will now end it. This is Group 1 and goodbye.